to introduce myself, I'm Lauren Kelada. I'm a researcher at Sydney Children's Hospital and UNSW, or at the University of New South Wales in Sydney. And I'm part of the Behavioural Sciences Unit, so we do research on childhood cancer and the psychological effects. I'm the team leader of the Family Systems and Relationships team, so all of my research is looking at the family impacts of childhood cancer, because we know that it has a ripple effect for all family members. It affects every family member individually, and it affects the whole family as a unit. So one of my studies at the moment is looking at siblings of children with cancer and other chronic illnesses. And one of my previous studies was looking at grandparents of children with cancer. So that's what I'm going to be talking about today, is grandparents. So I only received one question before the start of this webinar. I thought I'd read it now because I'm hoping that throughout the webinar I'll touch on some things that can help them, hopefully. So the question was, I'm travelling to New Zealand to be with my son and daughter-in-law and my beautiful 2-year-old granddaughter who has relapsed with AML leukemia. I'm so worried that I will not be able to support them emotionally as I am so distressed myself. She will start stem cell treatment in 2 weeks and has already had a bone marrow transplant at 6 months old. She appears very strong presently, but how she was in 2017 haunts me. I would welcome any advice. So firstly, I'm very sorry to hear that she has relapsed. In terms of advice, I'm hoping that I'll be able to, throughout this webinar, show you some resources that can potentially help you, and really just emphasize the need for grandparents to look after themselves, and that it's so important that if you want to be that stability and source of strength for your family, you also need to nourish your own needs. So that's what I'm going to be talking about today. I think firstly, I will go over some of our research, and then secondly, I want to talk about a booklet that we developed in conjunction with Redkite, specifically designed for grandparents based on what we were hearing in our research from grandparents. So to begin with, I'm going to show you just some of the papers, that we've put together. So in this study, we were looking at grandparents' distress and support and barriers to care. We've looked at family functioning. We've looked at quality of life. And we've looked at information needs. So what we know is that grandparents are profoundly affected when a child is diagnosed with cancer. And grandparents, like I mentioned earlier, grandparents are the bedrock of the family, to provide support to all family members, emotional support, financial support, practical support, and often that involves caregiving responsibilities, taking care of the sick child, but also taking care of the siblings while the child is at hospital and the parents are also at hospital. But grandparents often feel like bystanders to medical discussions. Healthcare professionals rarely take the time to talk directly to grandparents. And grandparents might feel uncertain about how to help. They feel uncertain about their role, and feel like they don't know how to communicate with their child or the grandchildren. And something that we see a lot of is grandparents are reporting conflict with their adult children. So after diagnosis, everyone is at a heightened state, and parents may be operating on very little sleep and have extremely high anxiety They may be irritable and snappy, and they might take it out on their own parents. And while that is completely understandable, it is really difficult for a lot of grandparents to have to bear that. And they really struggle with it, and that's what they were telling us in our research. So I'm going to skip some of these and go straight to the study that we launched. Was to look at grandparents of children with cancer and compare them to grandparents of children without cancer. And the purpose of that was to demonstrate the mental health needs of grandparents of children with cancer. So grandparents completed questionnaires about family functioning, about their distress, quality of life, mental health. And so this is the paper that I led. I found that family functioning was poorer, closer to diagnosis. Family functioning was poorer when grandparents lived further away and were unable to be a daily presence in the lives of their family. And family functioning was poorer when grandparents were caregivers for the healthy siblings. So all of this tells us that there are factors, complex factors that are into play that impact grandparents' perceptions of family life, and potentially more that hospital staff and mental health professionals can be doing to provide support to grandparents and support to the family as a whole. Okay, so in our paper, in our study, a big finding that we had was that grandparents had really high distress, really high anxiety, high need for help, low quality of life, high support needs, but weren't actually seeking help and weren't actually seeking support for themselves. And when we spoke to grandparents, we asked them why, they would say things like they felt guilty for looking after themselves. When their grandchild was in hospital, when their child was so distraught, they felt guilty looking after themselves. But this is a point that really needs to be emphasized, that you can't help others unless you help yourself first. You need to look after your own needs in order to be that backbone of the family. And so in order to really drive that message home, we developed a booklet with Redkite. And this not only talks about the need for grandparents to look after their own well-being, but also for where to actually get that help. Because one of the other issues, it's not just the lack of desire to look after yourself, it's also there's not a lot out there specifically for grandparents. So that's what we have done with the booklet, is to try to meet that need for grandparents. And so I thought I would just go through it now with you. So the booklet is on the Redkite website. I'll just bring it up now. So redkite.org.au, and you should just be able to find it. If you go to Google and you type in Redkite grandparents, it should be the first thing that comes up, this page. And you navigate down to here to other resources, and this here is our booklet. So if you just click on that, it'll take you to here. So this is the booklet. And these are the sections of the booklet, the main things that the booklet is trying to do. So the first gives information about cancer. The section here is on managing your relationships, supporting yourself, and then where to get further information. And all the quotes in this booklet are quotes from the grandparents who were in our study. So the information about cancer in this booklet, it's really general, simple information. Naturally, treatment is different depending on the type of cancer, and treatment might change year to year. So this information is just a brief overview of what might be involved with treatment, and it was developed in conjunction with oncologists and nurses, so it's all accurate, reliable information. And it goes through different aspects of the cancer treatment and long-term effects. And then this is the managing your relationships section. So I mentioned briefly earlier about potential conflict between parents and grandparents. And I think this quote sort of sums it up. From a grandmother, she said, "Try not to take any emotional outbursts from your daughter, son personally. Do as much as you can to help, but listen and give them space when they need to be on their own." And this grandfather said, "Make yourself available to provide whatever support is required. However, you have to stand in the wings and not take over. It is your child's job and they have to do it their way." So we go through and discuss providing support for different family members. So here to the parents. And we give some information about if you live closer, if it's a possibility for you to be around physically daily or weekly. Some tips, just small things can really help. So things like taking care of the siblings at home, driving siblings to school, running errands, grocery shopping, cooking. Those small things are really important and really helpful if you live nearby and that's a possibility. But then also we do have lots of grandparents in our study, and obviously just generally grandparents who live further away and it's not a possibility for them to be physically around, but you're still an important source of emotional support. And so things like providing a listening ear, sending text messages throughout the day to say that you're thinking of them, phone calls, emails, Skype, video calls, letters, they're all really important. Don't underestimate the value of that kind of support as well. And if you're in the position, financial support is also an important source of support. And here, this grandfather says, being in a different country means we've not been offered any support services. And that's an important point, because if you're a grandparent who can be on the wards with the family, you may get the chance to speak to one of the social workers or to one of the nurses and get some support in that way, or at least get directed to where you can get some support. If you're not living nearby, you're living in a different country, it's even harder because you don't have that interaction with the support services of the hospital. And so that's why things like this booklet and the resources at the end of the booklet that I'll show you later are really important, and it does take a little bit of active looking for these kind of things if you're not nearby, but are really important that you also look after your needs. So go check out the resources and speak to your GP if you feel like you're really struggling. You can get a mental health plan that way. And supporting the grandchildren. And so this grandparent says, be compassionate toward the child because it's hard for healthy people to relate to children undergoing chemotherapy and understand that their mood can change suddenly for no apparent reason. So the child going through cancer can be moody and irritable, and it's all just about patience and compassion in dealing with that. And just some age-appropriate information about how children cope and how to discipline children, the difficulties of how to maintain those boundaries that you need to have for children while they're going through cancer treatment is really difficult for parents and for grandparents alike. And some information about talking to the siblings as well. So for siblings, after diagnosis, I should say, siblings can feel neglected. They can feel like they've lost the attention of their parents. It can be quite difficult for them from that perspective. And that's why grandparents have a huge role to play for helping the siblings. Grandparents can be a great source of just shining a light on those siblings and giving them all of that attention that they need, that focused attention to help them feel like, you know, an adult in their life is really paying attention to them and they're getting to be centre of attention for a little while. That's a huge role for grandparents to play and not to be underestimated. And then managing some other relationships. And then supporting yourself. So as I've mentioned a lot throughout this webinar, it is so important to look after yourself and to look after your own needs. And so we have some information in here about how to do that, how to take some time out for yourself, and how to communicate your concerns. So we have one grandmother here say, I spoke with my doctor and received a referral to a counsellor who helped me plan how to avoid depression and keep myself active and healthy. So I know that it can be difficult just in general talking about mental health, but particularly in this situation when your grandchild has cancer, to talk about your own health. Grandparents in our study mentioned it as they felt selfish for doing it, but it's really not. It is essential. And I think that's something that we want to push with our work. It's not just okay to look after yourself, it's essential to look after yourself. And so one of those ways is you can talk to your GP, you can get a referral to a counsellor or a psychologist, and come up with a plan. And the great thing about doing it that way is you get a tailored plan for your particular situation, and your particular family, because every family is different and every situation is different. So to have a chance to speak to a health professional one-on-one, and come up with a plan for avoiding heightened distress and avoiding depression is really, really helpful. I've got some information about getting information about the cancer and getting information about treatment can be quite difficult, and sometimes, well, as we found in our study, grandparents feel shut out of conversations about treatment and about the cancer. And so it is something that grandparents can sometimes work together with the medical staff or work with social workers or nurses to help them get the information that they need. And in that way, the parents don't have to constantly be the go-between between the health professionals and the grandparents and relaying the information that they're getting. If grandparents can talk directly to nurses. So if that's a situation you find yourself in, there are nurses out there who are very willing to do so, very compassionate and understanding that grandparents are a huge part of the family and they have their own questions. And if you find that you have a nurse on your grandchild's oncologist team who you can talk to, you can ask them these questions. They'll take the time to answer it for you. And getting support for emotional difficulties. If you have people in your life who you can talk to about these things, it could do you a world of good. We have this grandparent here who says she spoke to her colleagues who are her close friends and knew that they would understand and support her. And so talking to other people can be really helpful. Sometimes it's informal support, so it's your partner or your friends, colleagues, a priest maybe, and sometimes it's more of formal support where you go to your GP or a counsellor or a psychologist. Whatever works for you is great, and whoever you feel comfortable with, that's the important thing, whoever you feel comfortable with and who you feel supported by. And then we've got a little section on advice from grandparents. So these are the grandparents who participated in our study. Some advice that they give: learn to listen and try not to give advice about cancer or tell the parents of the sick child something you have heard or read about cancer. Take one day at a time and trust the advice given by medical staff. Use all services available. Become informed and use as many sources as available to find out as much as possible. And then we have a case study here written by a grandparent. And some useful contacts. So these booklets were designed for Australia, but Redkite also operates in New Zealand, Camp Quality also operates in New Zealand, so there is some overlap. And here are some other useful books or booklets out there that some of them are free and they're really great resources. So these ones are books that you can read to your grandchild who has cancer. So this one here you can get for free. Things like Joe has leukemia, Tom has lymphoma. You can download those for free. And Katie's Garden, a little girl's experience of cancer, and that one's for free. And these ones are for young people with cancer, so who are older than what the children's books would be for. So these are just for a bit older kids. Some of those are for free. And here for siblings of children with cancer. What About Me? A story of the siblings of sick children. My brother or sister has cancer, so those ones may be helpful for you to sort of get a sense of what the siblings are going through. And these are for parents or grandparents. So some of these are designed for parents, but are also appropriate for grandparents. And then some, like this one here, you can see, are specifically designed for grandparents. Okay, so that's the booklet. So you can find that on Redkite. Like I said, you can just Google Redkite grandparents and it should be the first thing that comes up. If you have any issues, I can send out links or maybe even get them to post out hard copies for you, so you can just contact them if you want a hard copy, but any issues you can come to me. And I guess the final thing that I wanted to say was I've also done research from the parents' perspective, talking to parents. The number one thing that they say is what got them through was the support from their own parents. The invaluable social support, the emotional and financial support and practical support, that parents really value it. They may not say it at the time, but they really do value it. And in order for grandparents to be able to continue to provide that, they need to look after themselves. I know I've really hammered home this message, but it is so important to be able to look after yourself, to be that stability for your family. I hope you found this helpful in some way. I do encourage you to go download that Redkite booklet and to use the other resources to get help for yourself. Right, well, thank you so much for joining us today, and thank you for having me. Yeah, bye.